welcome to yet another exciting opportunity of creating awareness on different special needs. Today, my team and I will be heading to meet the very knowledgeable and experienced Dr. Ritesh Patel, who is a consultant orthopedic spinal surgeon, who will shed more light on spinal-related conditions and disabilities in children. My name is Caroline Debuadege, founder and executive director of Gifted Gems. But first, let's look at the statistics. Children account for only 5% of all individuals who sustain spinal cord injuries. 60 to 75% of all spinal cord injuries occur in the neck area. It's also good to know 20% of all spinal cord injuries affect the chest or upper back. The remaining 5 to 20% involve the spinal cord in the lower back. This is according to the Children's Hospital. While these figures may not seem too big or alarming to the family that is affected, this actually takes a toll and a different trajectory for the child. And that is why we are doing this today, to enlighten us on matters, once again, spinal-related conditions and disabilities in children. Karibu sana. Hello and welcome to yet another exciting opportunity to discuss about spinal injury and related disabilities in children. Daktari, karibu sana.
Yeah, thank you so much. So, very good morning. And first of all, I would like to thank you, Gifted Gems people, who had given me chance to bring some little awareness among the mothers and the children who are really suffering with all those issues, which is disability and deformity during the childhood. So myself, I am Dr. Ritesh Patel. I am consultant orthopedic spinal surgeon. I work in many countries, but I have my hospital in Kenya, which is located at 3rd Parklands Avenue and at Dr. Spark building. The second floor, we have made the very recommendable orthopedic and spine center, where we do all kind of tertiary work like all kind of endoscopic and minimal invasive spine surgeries, and we do all the replacement surgeries like hip, knee, shoulder and elbow joint replacement surgeries we are doing here. And it is good to know that we are getting that opportunity, that how these caregivers and mothers are really suffering when they found some disabilities in the children from the birth. So first of all, we are talking about the spinal cord. So the overview of the spinal cord is basically a spinal cord is a neural structure. In layman language, we can use it as a messenger which carries the messages from the brain and handing over the message towards the activity like hands and legs and other things. So that this is like we are making like a connection with the wirings that is called basically a spinal cord. So whatever brain wants us to do, let's say brain is telling that hold the glass, so whatever the activity is happening, the brain is passing the message to the spinal cord, and that's why the action is being done. Spinal cord, we have a spinal cord is further divided into 5 segments. First is the cervical, which is directly attached to the brainstem. After cervical is a dorsal segment, which is called thoracic or dorsal segment. After that, there is a lumbar segment, and after that it is a sacral and coccygeal segment. Spinal cord ends at the level of lumbar 1 vertebra. After that, there is only the nerve roots which is carrying the further extensions. So this is the basis about the spinal cord.
Maybe Daktari, I can just request you to show us with this very fine sculpture what you are talking about when you talk about the cervical, the different parts for the many parents out here who who may not have an idea where those parts that
that's
you've
true.
mentioned are.
See, our human spine is made up of actually 33 vertebrae. Out of them, this is a model which is only having a lumbar spine vertebrae. But it is like this, that cervical spine is having a 7 vertebrae, thoracic dorsal spine have a 12 vertebrae, lumbar spine have 5 vertebrae, sacrum have 5 fused vertebrae, and coccyx have 5 fused vertebrae. So that's how total vertebrae are there. Now here we have a model of lumbar spine, so at least it can give you the idea that these are the hard thing is the bone, which is a vertebra, and in between the vertebra is a soft jelly like structure which is called as a disc. So this is the front portion of our spine. If you go to the back portion of the spine, from top is the brain. From brain, the spinal cord continues as a cervical cord, then dorsal cord. Then it ends at lumbar 1. After that, there is a nerve roots, which is passing like this. Normally, this is the posterior structure, behind structure, where both these vertebrae is connected here with the joint. So this is covering the full spinal cord. So that's why spinal cord is protected 360-degree with the bony segment, and that's how it is utilized to protect the spinal cord, that it do not get damaged. Okay, and the spinal cord gives nerves like this on both the side, right and left, and then those different nerves make a big nerve and passing towards to the limbs, like upper limb and lower limb.
Okay.
Yeah.
Thank you very much. I believe to most of the caregivers right now, that is more clear. They're able to relate with that. So, Dr. we know that the spinal cord is actually formed, when the mother is pregnant in the womb. But at what stage really does it form?
The beginning of formation of neural arch and neural tube, which normally starts at around 4 to 6 weeks after the conceptions, and the fully formed spinal cord normally reaches around between second to third trimester, where at least the spine has been formed completely. Okay. But when you talk about spine and spinal cord, is different. Okay. Means spinal cord will be developed, but the bone is still developing. So vertebra will still take time to develop, and during that development, we might incur with some vertebral anomalies, which is called as a congenital anomaly. And that's why it is important to go for the first trimester scan and second trimester scan and third trimester scan. So once you go for first trimester scan and second trimester scan, the bony abnormalities related towards the spinal cord, spinal column, related towards the femur bone, and related towards the foot can be identified.
Okay. Thank you. I'll maybe just ask you to just make that difference again between the spine and the spinal cord.
Yeah, the difference is that the spinal cord is a neural structure. So it is made up of mostly all the nerves, which is carrying all the sensations and motor actions. Okay. So that spinal cord is divided into the further nerves, and that nerves goes to the muscles of the hands and legs, and then that's how it makes a whole kind of connections. Now spine is a bony structure because that spinal column protects the spinal cord into the cage, and that's why I have also mentioned that the vertebra behind covering 360-degree the spinal cord. So the spine, if the spinal cord is passing like this, it is covered 360-degree from the bone. That is called vertebral column. Now vertebral column formation takes slowly as compared to this. So if there is a failure of development of those vertebral column correctly, which creates this kind of deformity, which is called as a congenital deformity. So in that criteria, if we go, suppose if there is a failure of development of the posterior column, means this the arch which connects, then it ends up into spina bifida. If there is a failure of formation of full vertebra on the one side, it ends up into the hemivertebra, which causes the scoliosis deformity. So that's how you might end up into so many deformities like that. Some deformity which is in the brain, which is called as a hydrocephalus. Hydrocephalus means there is a excessive collection of the water in the brain, and that's why the brain and the skull formation takes place like that, it is very bigger. So those kind of congenital abnormalities are there.
Okay, thank you very much. I know there's a parent out there asking, I've gone for the scan the first trimester, the second, and the spinal bifida condition has been, picked up, or another condition which we will ask you to also be letting us know on about, and they're asking, is it reversible?
No, see, if in the first trimester scan or second trimester scan, if you picked up this kind of condition like spina bifida, clubfoot deformity, like bowing of the knock knee deformity, all those deformities which is in the womb, if it is you are finding in the first and second trimester scan, those are a congenital deformity. Those are not created by any movements of the mother or any movements of the kid, infant inside. So it means those are related to the chromosomal abnormalities. When there is a conception happened between the male and female, at that time whatever the deformity is there under the chromosomal deformity, so that ends up into the kid. That's why we found this kind of congenital deformity. Scoliosis is also one variety of congenital deformity. Clubfoot is also one variety of congenital deformity. There are some congenital deformity which comes as a syndromic child, like Down syndrome, Turner syndrome. All kind of aneuploidies can also happen. Those are the congenital deformity, which is basically related to the chromosomal genetic deformity of the person. It is like this. Let's say, suppose if there is a chronic renal failure male who is having a normal wife, and if that chronic renal failure is congenital since birth, then there are high chances that their upcoming child might get or not get. Suppose if the first child is not getting, then second child has a chance to get it. So because the carrier is on the chromosomes, and that chromosome, if it becomes while division during the pregnancy, if that chromosome divides and make the one chromosome fully in the kid, then the kids will develop those kind of abnormalities. This is actually a genetic issue. So I am not a genetic doctor, but I'm just briefing you about this.
Thank you, Dr. for the fact that you have been shedding light on this issue. You've brought up a point that many caregivers need to actually realize, because they go down the self-blame game. Maybe I did something, maybe being the African culture, somebody looked at me with a bad eye when I was expecting, all these things. So you've brought it up, being congenital, so that the caregiver does not blame or the mother.
Yeah, that's very good thing. It is not in this, but in the whole world. Mostly the blame game goes to the woman who is carrying the pregnancy. Yes, according to me, it is nothing to be related to the woman. Yeah, some care is very important during the pregnancy, and mostly all the pregnant women are excited, so they normally take the good care of relatively. But when it comes to this kind of deformity is not in the hands of even kid or even mother, because those kind of deformity is basically a congenital chromosomal inheritance deformities. So that is depending upon your structures, like suppose if any family history of inheritance, and then you are again sending it, like if mom is having thyroid and the daughter is also coming with the thyroid, that is most common. Right? If the father and mother both are diabetic and the kid develop the juvenile diabetes, it's very common. Even if there is rheumatoid arthritis, there are so many juvenile rheumatoid arthritis where the family history is there and you got the inheritance of rheumatoid arthritis. So the same way it is like this, that these are the congenital deformity. You can't stop it, you can't prevent it during the pregnancy, and because chromosomal defect is chromosomal defect, it cannot be corrected. So yeah, after coming out and surgical correction is a different story. What I'm talking right now is by itself, self correction is not possible.
Okay.
Yeah, maybe in the futures, as we are now in the world of robotic surgeries, maybe we will come across that kind of during pregnancy correction. If it happens, I would be glad and happy to know that. Yes.
Okay. I think that's important to know it's not correctable when it's in the womb. And also, maybe earlier before we were discussing about a movie that there are movies that show it is correctable, but from Dr. position, you can hear and learn that it is actually not correctable when
No,
it's
in
in the
some
womb.
developed country, if there is in some developed country, they do some research. So maybe that is a part of research where they have tried and maybe they succeeded also, maybe they don't not succeeded because you haven't taken the chronic follow-up of the condition of the patient. Let's say if they're showing that they are corrected, but after that you haven't done the follow-up of 2 year child, 3 year child, 4 year child to see that whether it is still correct thing or not. So it's very difficult to predict. But yeah, there are some researches in the robotic science and other things. The medical science is always evolving, so you never blame it. It might be happening in future also.
Okay. Yeah, now, Dr. there is this common debate, especially between women and expectant mothers. There are those that say folic acid is important. Why I'm bringing that up is because of the bone structure, and others say folate in the food is important. So there has been a debate that folic, being a supplement, increases the chances of getting a child who has a condition, disability, because it's not natural per se. And there is also the view that if you eat folate foods rich with folate, your child will have lower chances of having a condition. Now, how true is that? Is it a myth? Just to put the matter at rest, because out there it's a real it's a real
No,
topic.
it's a correct question, by the way, that all of us are very much excited to know that whether any supplement is very necessary when the woman is expectant, you should provide. Yes. So for that reason, we are providing the iron, folic acid, folate, and sometimes we also give vitamin B12 because all those things are very necessary for the faster formation of and faster development of nerve and bone tissues. That is correct thing. But deformity never comes with your consumption of folic acid and methylcobalamin or any other supplements during the pregnancy. Because whenever most of the deformity we have found is like, suppose if the dad and the mom is already B12 deficient or folate deficient in their body, and then they end up having a child, then there are high chances of having deformic child. So that is something which you do not correct once the pregnancy is there. You should correct it before you plan for pregnancy. So if the parents should go their screening of B12, vitamin, other things, and the aging factor also, like suppose if mom and dad should be between below 35 and mom should be below 30. This is the good age to get the non-deformed kid. Mostly deformity comes when the pregnancy has been sustained at the old age, and so many congenital problems are more invited if it is to be carried after the girl is above 30 and 35.
Oh, thank you, Dr. So now we want to know, as when the child is small, are there any activities or lifestyle behaviors that actually a pregnant mother can engage in that can cause a spinal injury or for disability, no, but a spinal injury for the child in the womb?
Apparently, it is not possible. The spinal injury is a very big word. Spinal injury mostly happens into the adults.
Okay.
In this kind of small baby, spinal injury is very rare. Only it can be possible during the delivery point, but it is also very rare. So those is not possible unless if pregnant woman comes into the road traffic accidents and other things while carrying the pregnancy at the full term, and then during that time if there is some injury directly comes to their tummy, and if it damage to the spine. Otherwise, spinal injury word is very difficult to say in the children's.
Okay.
Mostly whatever the condition you are talking about, spina bifida, hydrocephalus, club foot, rickets, and all those things, mostly they are related to the developmental abnormality, deformity. This is congenital, or all those things are there.
Okay. Okay. And there are those times when you find that a child could be having, the mother could be having a condition, say epilepsy, and there are certain drugs that the pregnant mother is actually taking. Could it also have an impact?
Yeah, that is a good question. Drug-related teratogenicity, that is the word it is used. While pregnancy, if you take some medication which can be a teratogenic to the kid, and yes, those are some drugs which can really affect and do some kind of damage to the kid. But most probably they cannot do this kind of damage what you are talking, like deformity cannot come.
Okay.
This kind of congenital deformity can never come. But yes, there is a mental retardation, right? Mostly it is a low birth weight baby, growth retardation, mental retardation, all those cerebral palsy like issues. So means the moreover it is related that which is related to the growth and the developmental retardation.
Okay.
The drug can do that.
Okay. And now we are so excited when we get the newborn. You know, for many parents, some and caregivers, they might start throwing the baby up in the air. You know, activities that we as caregivers can actually engage in. They seem unharmful, but could they be harmful to the child, and especially the spinal cord?
Oh yeah, that is true. It is not directly harmful, but yes, the aggressive movements like playing with the kid aggressively and the excessive neck movement, neck flexion, excessive movement of the other things, that can end up into doing some damage to the spinal column, and then indirectly to spinal cord. Yes.
Okay.
Like excessive flexion. See what happens while the accident also happens. You have a seat belt, but your neck goes like this. So that injury is called hyperextension and hyperflexion injury. If you do that kind of injury, then there is some damage can occur. But I have never seen this. Very rare.
It is rare. Okay, so there is nothing from the caregiver's perspective when the child is very young that can predispose the child.
You have to be careful. Like fractures are more common. With the small kids, in my opinion, fractures are more common because the kid might fall, kid might, somebody might pull the hands and leg, right? In a wrong manner, you never know. So those kind of dislocations and some fracture injuries can happen after the childbirth.
Okay.
But this kind of thing, what we are talking about, spinal cord injuries, and those are very rare. Head injury can happen. All those things happen when the baby fall down.
Okay. We've had, there's been a school of thought that the trampoline, that up and down movement, if it's unchecked for a child, you know, now they are very excited to go play. It could actually have an impact on the spinal cord. Is that true?
It is more or myth.
Okay.
Because trampoline can not do if it is a very early age, yes. But we know that 1 year and 2 year kid cannot go to trampoline. Or so if they go, then it should be monitored by the parents.
Okay.
That how far they are going.
Okay.
So otherwise, if after certain age, that kind of the injury which I told, like hyperflexion and extension injury, is anywhere possible if you do the excessive thing.
Okay. Okay. And we've also come to learn that there are certain there are certain conditions that look related, but they may or may not be related. I think alluding to what you've just said, something like we found in the previous research we've done, many children with spinal bifida actually end up having hydrocephalus, or they have both, and their parents who feel that these come together. In fact, we've even come across a support group that has combined the two, because most of the caregivers, the children, have they have hydrocephalus as well as spinal bifida. So there seems to, the question out there, is there a correlation between the two?
Yeah, the correlation is not directly related. It is like we can say it's a syndromic child. Means once there is a one deformity which is congenital, other deformity is also there. So hydrocephalus and spina bifida is totally different deformity, because spina bifida is a developmental deformity of the formation of the vertebral arch, and hydrocephalus is a other deformity of the head where there is so much excessive liquid there. So it's a deformity of moreover the brain tissues deformity. So both deformity is coming from the different notochords and other things, right? Different nerve tissues, and this is the bony tissue making the arch. So both are not related, but it is somehow related because it is a syndromic child. So the child is having both the deformity together. We can put like that. So when the child is syndromic, let's say I have already told you that when during the trimester scan, you can find out that if the child is ending up into the Down syndromes, Turner syndromes, or any kind of other syndromes, which is congenital aneuploidies, when that kind of aneuploidies comes, that comes with different condition. Like in Down syndrome, you can get the short stature neck, you can get the webbing of the neck, you can get the club foot deformity, you can get the short femur, you can get the kyphosis scoliosis also. Sometimes you can get this kind of tethering cord, spina bifida, all those things. So those are actually a syndromic child. That's why both the things are coincidentally together.
Okay. And now that we've discussed about the conditions that actually are experienced, what are some of these symptoms as a caregiver you can look out and say, actually I think my child has a spinal injury? What are those things that would tell you something is wrong with my child's injury? I mean, with my
See, spinal injury word, if when you are using,
cord.
if there is a spinal injury, then patient normally the kid, because spinal injury, the symptoms is paralysis. Spinal injury means there is a damage to the spinal cord by any means, and when it occurs, people normally get the paralysis, like history of fall from the heights. What you get is paralyzed. Gunshot wound, spinal injury, paralysis. So the biggest symptoms, which start slowly, but the first thing is the involvement of the either paraplegia or quadriplegia. Means if the injury is at the cervical level, all the limbs will not move. Your sensation of the bladder and bowel will go, so that the stool and urine you will not able to control. But those injuries are very rare in the children's. That's what I'm telling. Because children's are mostly supervised by the people. When they are not supervised at certain age, after toddler age, there are high chances that if they are not supervised, then they might get. But normally young children are supervised. So spinal injuries are less. What I think your question should be, the symptoms of how you can justify the deformity. That should be your question. And justifying the deformity is this, that you correlate whatever is given into the first and second trimester. Let's say in first and second trimester scan, if they have told you already that the baby is having a club foot, so after baby comes out, you might do the x-ray for the foot and you justify that it is correlating or not. If it is not correlating, no need to worry. If it is really correlating, then start consulting the doctor and go for the correction. Maybe it might be more faster correction once you will find out early. So if detection is early, treatment is early, and the results are good. The same way is like if you found out the hole in the heart like ASD or foramen deformity, any, or phallostatology, all those heart related issue also you can justify into the first and second trimester scan, and then you can find out.
Okay. Thank you for that. There are those times where now the caregiver, like in one of the incidences where we met a caregiver, she said that she was actually referred to Kijabe to have the child checked for spinal bifida, and a surgery was done. That's the early intervention you're talking about.
Yeah, sometime if you go to the consultant, like you are going to the specialist, and if he find out the deformity like spina bifida and other things, so for the prevention purposes they normally do correction also. And if it is associated with other deformity, then correction is more required. Let's say spina bifida and it is associated with tethering of the cord, then you have to do that.
Okay.
If spina bifida is related with hydrocephalus, then you do the correction. If spina bifida is associated with some dural matter deformity like diacetomyelomalacia, and there are so many other deformity, congenital deformity. If it is associated, then you do correction. Otherwise, I have seen many patients with spina bifida who live very beautiful life without doing anything.
Oh, okay. They actually go through life with the condition.
I have many, even adult. I can even show you the X-ray of 56 years, 60 years old people having spina bifida since birth.
Okay.
So, unless it is related to other conditions, yes.
Okay. Because we've also seen in some of the corrective measures, like the surgical one. Let me say that one of the things that stood out was that after the surgery, the child loses mobility. Like if a child was walking slowly but surely, the child lost mobility. How?
See, it is very difficult to predict the results with those surgeries. The reason behind it is things are congenitally deformed. So it means that whenever you are doing correction, and you might end up into doing some injuries to the nerves because nerve structures are very near, or maybe some nerves are already damaged because of that deformity, and you have just done the correction here, and coincidentally children is developing the symptoms slowly, like milestone is delayed, but there is no correlation with your surgery and there.
Oh, okay.
Only there is only one correlation is if the nerves are involved during the surgery. If there are some surgeries where the spinal cord is popping out of the spinal cord of the spinal column, there is a hole, and then you correct it. Those kind of surgeries, if you are doing, then you can predict that they may end up into some minor complications, which is called as a slowing of the results here.
Okay.
Otherwise, normally spina bifida and other surgeries results are good. Only the results are not good in the other congenital deformity, where you can't predict. Wherever the nerves and nerve matters are involved too much or damaged already because of the deformity. So we are being a doctor, we are not God, so we cannot correct that. We correct the deformity. Rest, the nerve correction is done only by the regeneration itself, the body.
Okay.